I think it's very important that all of you see what the real patients are. We can stand up here and tell you the science and everything, all that. But really, it's important to hear what patients who've gone through this process, how they did it, what to expect, how to prepare yourself. I think that's really important.
Hi, I'm Justin. I've spent a lot of money to be here. I mean, a lot of money. This is not, my journey it didn't start here. It didn't start back when I had my surgery. I grew up as a fat kid. I graduated at 18. I'm just going to give you guys a bit of background about me so you know where I came from. When The Simpsons originally had that the fat German kid running in the change room crying, "Please don't make me run, I'm so full of chocolate." That hurt, you know. And Homer going, "That kid has boobies." Yes, it did. Lots of pain. And people ask, oh, well, I had this question come up today, you know, so what was the turning point? And I thought to myself, you see my success, but you don't see the trail of failures. You don't see the lifestyle cookies, you don't see the diet fads through the 80s, 90s, and 2000s. And I'm just going to tell you straight up that I'm low carb, and right now I'm keto, and you know, I completely and totally subscribe to the idea that you pick something that you actually can do and maintain. Because I've been doing this now since 2003. My first son was going to be born. A doctor told me that I probably wouldn't see his 10th birthday. And that was not a kick in the ass, it was just yet another reminder. So I went through that, went through the weight loss, gained it 13, I didn't gain it all back, but in 2013 I said, nope, going low carb, boom, done. And I maintained that for a couple of years. And I had the opportunity to, so one of the things was that I lost the weight, and I had a lot. And I had the fat hanging down the sides, I had the pannus over, and a friend of mine who's a bodybuilder, she said, well, you should go and see Dr. Lockwood about surgery. And then when I came here and I saw him, I consulted with him once, and then 6 months later or so, I'm like, okay, I'm going to try. And then Avi apparently was the better choice, and I was told that that was the case. I was promised that that was the case. It was. Avi is my doctor. And what basically happened is that I went through a surgery November of 15, and then like that 3-month thing, they couldn't quite fit it into 3 months. They slid me in the end of January, I think. So it was beginning of November, end of January, that I had the second surgery. My first surgery was fleur-de-lis, so that was that whole, and I'll show you guys right now, because this one isn't gross. You can't even see the cut and the moved belly button, okay? I went through that. That was the first surgery I'd been in my entire life, other than cutting my leg open when I was young. And it was the first time that I'd ever laid down on a table where they're gonna put me out, and I'm thinking to myself, people who usually see these lights are fighting for their life, and here I am being selfish, being shallow, being whatever. And I won't trade that. Like if I had the money again and I was back then and I know what I know now, I would go through this 100%. Because what I learned going through that was that my life every day, everything that I was doing, like I was weightlifting to fill my excess skin. I was trying to not have to do anything surgically and trying to just bulk up so that I don't have to worry about it. And there's still parts of me, even though I'm now in my third major surgery and probably 3 or 4 adjustments, minor adjustments, cost-free adjustments that Avi was taking care of me. Between November and January, I never got the chance, or I got the chance to actually start to work out. And weightlifting was the first thing I was allowed to do, because weightlifting isn't intensive to the skin, right? It's not shaking the skin, cardio is. But just before my surgery, Avi said, yeah, sure, you know what, if you want to run a lap or two, and I used to play football, so, you know, sprint, that was my favorite thing. I ran a lap at the downtown Y. Loved it. I flew. I felt like I was on fire. It was fantastic. Except my back hurt. My back hurt. And it was because the skin kept shaking. And that's something that isn't covered in the material here. It isn't covered anywhere else. But it's 1,000 tiny fish hooks that you don't feel every day when you go upstairs or downstairs. Maybe you feel a little uncomfortable or socially awkward because, you know, you're trying to hide something. You know, I've always had to wear my pants on my hips, therefore the ass crack is down low, and your pants don't ride right, and that kind of thing has always impacted me in my life. But to actually understand that the things that I do in the gym now, the exercise that I engage in, and it's not because I feel I have to because of weight loss, it's because I find it hard to sit on the couch now. I find it hard to actually, like, when I had surgery, I was like, oh my God, I get to watch all these shows that I've been meaning to watch for years. And this is the sort of, like, there's so many different experiences that, maybe some of you know because you started off thin. I never did. I didn't realize that you can actually look into your pants pocket. Like, I thought jean pockets, they were a mystery, right? Like, it's like, oh, what I got in this one, right? Like, that was my life. 3 weeks after my first surgery, when Avi decided to give me a new belly button, let me remind you where my belly button is. It's right here. So I'm standing in my living room, and I just absentmindedly go to scratch my belly button. Muscle memory, that's where my belly button was. The change that you have, the scars that you're trading aren't just for your self-esteem. They're actually functionally better. Now, I have a bra strap scar across my back, which is the most obvious scar that I have, with exception to the 2 that I've just earned back January 8th. So, by the way, I'm also a lot more full right now because I tore a pair of jeans yesterday. I thought it was okay. Like, I've been living in sweatpants and like Lululemon kind of Lululemon men's pants. Let's be clear. But I was living in those pants, and then I'm like, okay, well, I found this pair of jeans that I can finally slip on. And I actually had to go to a funeral a week after my surgery, and I couldn't even, it was overwhelming. I couldn't even handle it. Like, I had to go home. Like, you just don't understand. While you're in that first 3 weeks, just driving home, my dad was taking a phone call. And this is a minor surgery. I've got 2 cuts here to try to adjust that space that Avi talked about between. Because I'd still get that sagging and that fold over coming in underneath. So my dad's on the speakerphone, and he's just chatting, and it was like, Dad, you have to end the call. Like, it's overwhelming. So when you go into that, make sure that you prepare your life for it. Like, this is a shutdown, take care of yourself time. And when I went for the surgery, and they talked a bit about the blood clots and stuff like that, that freaked me out. That freaked me out. I could die from this. I could die from not wanting to have this stuff. Every hour, like, I didn't even have to try to wake up. Every hour, I woke up, and then the person who's taking care of me would help ease me so that I could stand, walk, went to the bathroom, check my blood grenades, which they're fun. They're not. They're not. But I would check, and then I'd go back to bed. I would actually walk every hour for the first 24 to 48 hours on my first surgery, just because I was just freaked out. But it's all okay. So, like there's so many things. Sweatpants. Do you know that sweatpants, they actually need them for Thanksgiving? Like, I didn't know this. I wore jeans, I overate, and because I always had, my pants didn't sit in the right place, and it was across my stomach, and I'm in such pain, and I'm like, what the hell? And I have diverticulitis, or diverticulosis, and I get bouts of diverticulitis. So I thought, oh no, am I having that? And then I, go to the bathroom, undo my pants, I'm like, oh, I'm alive again. So, like, but there's just so much stuff. There's so much freedom in it. I could have bought a Civic, and then I'd have a car that's only worth $5,000 this year, right? Instead, I bought something that made me feel better for the last 5 years and continue for the rest of my life. So when I think about that investment, I mean, it's all up to you. I mean, it's your journey. If you guys have any questions, I'd be more than happy to answer them. I can tell you about everything, mostly about Avi.
I don't have a question, but I have a comment.
Yeah.
I really like hearing that you said that there's so much freedom. Like, I'm at a stage in my life where I kind of thought, is it really worth it? Like, it's not like I'm in my 20s. It's not like I'm in my 30s. I'm thinking, I think I'm too old for this. I think that this isn't something
Can I ask?
I should be investing my money in. But just hearing what you're talking about is what I'm wanting. I didn't get that in my 20s, for most of it, or my 30s. But I'm old enough to be able to make the choices to choose something that's going to make me feel good about myself and give me the freedom that I deserve.
Can I ask you a question?
Yeah,
How old do you think I am? Everybody hates this game. Go ahead, just throw it out there.
don't do that.
Listen, if you go low, I'll be really happy. If you go high, I start crying. So you win either way.
I'm gonna tell you something, I'm in my 50s.
Okay, so I'm turning 44 in 2 months.
And so I actually commented to someone and they said, you know what, really at this stage in your life, you shouldn't be thinking about that's ridiculous. You're too old for this. But why?
You're not.
I want what you just described, what you have. Why can't I have those freedoms and feel really good?
So here's a dumb thing that I do. Occasionally I go to the YMCA and I put my foot in a TRX strap. I don't know if you know what those are. The little straps there, right? And then I go into a push-up position and I walk myself until I'm completely upside down, and then I do shoulder presses. And sometimes my shirt falls down and I don't feel like I have to tuck it in.
Yeah. I get that.
Like, I'd say that you can't put a price on that freedom, but he did. And all the pictures are all about ladies, and that's fine. I'm going to give you an experience, and one of the things about Avi, and I haven't had the experience of working with you two. I think one of you worked on me though. Congratulations on having. They said, oh, it's a downside to have to flip a patient. Yeah, 240 pounds. Yeah, it is. I think they used a spatula. So when I was getting my second surgery, and so this is Avi's second go around with a Sharpie marker on my body. It was fantastic. He's standing there and he gets me to turn around. And by the way, here's my scar along the edge here, and you can kind of see it, but you can't. He's going around and he says, oh, don't be freaked out. I'm like, why? And then all of a sudden, whoop, whoop, down into the ass crack. And I'm like, what are you doing? And he says, well, when we pull upwards, we don't want to, extend you. We don't want to turn you into a plumber. So, but they think about those details. Like, I'm like, I don't have to think about anything. Like, they are going to take the best care. And there's a couple of instances that I've had with Avi where after the healing process, and I'm also super uncomfortable with my nipples because they're like large, round, flat. I asked him if he could flip them right side out, for my surgery. Apparently that's not a procedure they do. But there's a lot of chest work that he's had to do and a lot of revisions. And originally my scar for my back, my upper back stopped here, and he's made a couple of attempts before this one now to try to clean this up and make sure, and that was all because based on the wording in the documentation is that to the surgeon's discretion. But his discretion is that you are going to be happy and fairly. I mean, I asked for my hair back and he said, well, we could cut lower if you want. But the thing is that with those revisions, like some of those I was awake, sitting in a hospital. At one point in time, I was smelling my own flesh burn. It was fantastic. You remember that? Yeah. And we were having a pleasant conversation while he's burning me. Totally numb, couldn't feel it. But every step of the way, I never felt like I wasn't being taken care of, and that whatever I was investing into this, they take great pride in. So it's not simply hey, I want to feel good about myself. It's you're buying yourself freedom to be able to wear the clothes maybe that you want to wear, feel more comfortable in social circumstances, go to the beach. I'm apparently going to step on stage at some point in time for bodybuilding. We'll see if that actually happens. But it's something that it allows you to achieve those things that you never thought you'd be able to do. Any other questions? Yes?
When did you have your last surgery and what was it exactly?
January 8th, they were scraping away excess personality. No, so I had my last surgery with Avi was 2016, maybe summer of 2016, maybe 17. And those are minor revisions. And one of the things is that I do have those wider hips, and so whatever fat I had here accentuated and doesn't allow me to wear my pants up as high as I want them to be worn, or as they're designed to. So I had some lipo done, and also some cleanup of what was left over from when because they took a lot off of me. And the skin that I have that was joined here, once again, the scar, that was here was kind of out, like it was wider. And it was really weird because the sensitivity as it came back, I would scratch here and it would feel like it was out here. Like body-wise, the nerves hadn't connected. So with my latest surgery, it was cleaning that up. And then once again, I got a scar from here up to here on each side, just to try to get rid of the tenting skin that happened from my chest and my lats.
And that's the one you just had this month, right?
Yeah, 3.5 weeks ago. Yeah. And yes, I am up here talking about ripped pants.
So, for example, if you were to have a tummy tuck and you wanted to get some of that fat, say in your hips, because I don't have any, is that something that can be done?
Yep, so commonly referred to as a Brazilian butt lift. I mean, a lot of people have lost a lot of weight, get the flat bum, and they're like, I need my butt back, right? It's not filling my pants. And yes, that can be done. Some of those things have to be teased out a little bit because of recovery positions. So often we won't combine it with a tummy tuck at the same time. We'll do the liposuction to if we know that's a priority of yours, to do the backside and to get fat put in there, we will delay the tummy part of it. We'll liposuction the entire abdomen, use that fat, knowing that you're going to get a tummy tuck later on, put that fat into your bum, let you recover from that, and then 3 to 4 months later, do your tummy. Because you can't recover from that operation, means you have to lie on your side or on your tummy to recover.
I just wanted to clarify it wasn't my butt, but it was my hip.
Yeah, same thing. Yeah, same. Yeah, hips or posterior part of your bum. Yeah. Yeah.
I just had a question kind of off of that question.
Yes.
You had mentioned before you can take fat from, tummy tuck, the lipo area, and then put it into the breast. Is the effect of that as long-lasting as an implant, or does it eventually just reabsorb itself and go other places?
No. So when we take fat and we put it into your breast or to your bum, that fat actually maintains the characteristics from where it came from. So that's why it's important to maintain weight. We don't want to see fluctuations in your weight. We had a lady who did fat transfer to her breast. Within 3 months, she dropped 20 pounds. She lost all the volume that we put because her abdomen's where she stored her fat, and we use that abdominal fat. So what happens is it maintains the characteristics of abdominal fat. So that is the first place to lose. That is the first place to gain. So we do see some patients put on 5 or 6 pounds afterwards because they like how that area starts to fluff and become bigger, whether that's the bum or whether it's the breast. The one thing that we do know is that we do lose a certain percentage of the fat when we put it in because it does not have a blood supply when it's taken from you, and it needs to regain a blood supply back into place. So there is a loss because of that process. So if there are no more questions, I just want to thank Justin for sharing his story. I want to thank everyone here for also coming, and I definitely want to thank Crystal. Crystal is someone that I've sent patients to actually without even meeting her. Probably started 3 years ago. And my wife constantly tells me I need to lose weight and get in the gym and stuff like that and eat better. And so I started following Crystal on Instagram. And I actually really enjoyed the nutritional information she gave to people, the exercise activity she gave to people. None of it was a fad. None of it was aggressive. It was portion control, eat healthy, eat what you want, but just do it properly. And same thing with the activities. I followed a lot of your CrossFit stuff. I've incorporated that into my workout routines because that's all high intensity interval training that increases your metabolic rate. So I send a lot of patients to Crystal. So if some of you are struggling losing that last little bit or visceral fat, which you didn't really hit on, I would encourage you to see Crystal, reach out to her. She's been wonderful with our patients to help them along and just get them to where they need to go. So certainly I can vouch for her expertise in that. So thank you everyone for coming. We're going to be sticking around. If there's any other questions that you want to just ask more personally, please feel free.